Looking back on the experience, I realized just how sick I was. Just how in the moment you don't realize it. I just kind of had to fight each day just to get through the next. It's a battle that never ends. My name is Ella Balassa. I'm 28 years old. I have a biology background and have worked recently in patient advocacy, and I have cystic fibrosis. Throughout my life, I've had to take many, many courses of antibiotics to treat infections. In late 2018, I became very ill from a combination of a flare-up of a lung infection and catching RSV, a respiratory syncytial virus. And I was getting treated using some of the strongest antibiotics that we have in our arsenal today. And my body wasn't responding to it.
I'm John Rex. I'm an internist trained in infectious diseases and internal medicine. Antimicrobial resistance is a concern for all of us everywhere around the globe. Any one of us could develop an infection with an organism that's difficult or impossible to treat. Drug resistance in bacteria is a natural phenomenon that occurs every time a bacteria is exposed to any given antibiotic. Bacteria are constantly mutating, and over time, they will develop the ability to be resistant to any antibiotic that we have.
I was very scared. I didn't know if my life would continue.
We are constantly being threatened by infection. The challenges that we face with AMR and antibiotic resistance is to come up with new agents, novel classes that hit the problems in novel ways. So when we started Venatorx, we started with just 3 people, but we had some ideas for how we could overcome the emerging resistance. And we were fortunate enough that some of the ideas worked. And those ideas created novel classes with novel modes of action against these resistance enzymes. And that became the foundation of what we have subsequently built. We address carbapenem-resistant bacteria. In the simplest terms, we have invented 2 new molecules. One is in what they call phase 3. This is intravenous for the hospital. In the second drug, which is an oral drug, more for the community, we're in what's called phase 1. Think about the bacteria producing these families of enzymes. These are like wheels churning, chewing up your antibiotics. Both of our drugs were built to muck up those wheels, to stop those wheels, those enzyme wheels from churning. Now the antibiotics can come in and attack the bacteria. And when they do that, boom, they blow up the bacteria. You can treat from entry level in the community all the way to the sickest patient who has a ventilator in their lung in the hospital.
The difficulty with finding molecules that kill just the bacteria and not you means that antibiotic discovery is something that takes decades. COVID-19 has set the world on fire and shown us what happens when you don't have the fire extinguisher you need. By investing in new antibiotics now, we will invent the tools that we're going to need when the next superbug and the next superbug and the next superbug emerge. Because the next superbug is going to emerge. It's not a question of if, it's only a question of when.
AMR is going to continue as a pandemic and even accelerate and become more of a problem in the future if we aren't developing therapies that are not going to perpetuate this resistance. Dealing with that severe antibiotic-resistant infection made me want to share my story. I wanted to capture the attention of the public to develop new novel therapies for treating antibiotic-resistant infections so that less people have to deal with the terrifying experience that I did.